Toluca, the capital of Estado de Mexico, is where a lot of people from little towns and communities near and far the city come to because of a lot of reasons, and one of the main ones are the health problems. But the most recurrent and also important one are the maternal health problems.
The Monica Pretellini Hospital is really big and with wide waiting rooms. The nurses always had something to do, someone to take care of, and the patients most of the time were being taken care of. The offices are really small compared to the whole hospital. The main goal of the documentary is to improve maternal health and raise awareness of the problem among the population in Toluca City.
Days before the hospital visit, we had interviewed some former patients, and they and their partners were low-income people that came from outside the city and sometimes of remote towns by order of their local hospitals. Their dress was humble and in the majority cases didn't have an official work. Although we don't have a defined number, the interview doctor said that she receives like 18 patients per day.
Atención a los embarazos de alto riesgo y problemas ginecológicos comprometidos. ¿Sí? Nosotros tenemos dos vías de entrada. Uno por consulta externa y el otro por urgencias. Ajá. Urgencia, como su nombre lo dice, es cuando la paciente trae alguna urgencia. Aquí, como les menciono, son embarazos de alto riesgo. Ajá. Puede venir la paciente sangrando, ajá, o puede venir que ya la hayan atendido en otro lado, se les haya complicado y la mandan en ambulancia para que se resuelva el problema. También los bebés, cuando las pacientes tienen a sus bebés y tienen algún problema, el bebé se queda también hospitalizado. Aquí tenemos atención a neonatos, ajá, o sea, a bebecitos que nacen aquí. Eh, Se considera hasta los 30 días, pero bueno, hay pacientitos que nacen prematuros y se quedan hospitalizados a lo mejor, no sé, 2 o 3 meses.
According to cases of pregnant women, most at risk are being pregnant adolescents. Dangerous are raising adolescents becoming pregnant are between in 14 and 19 years old, and women with older age at 40 years old. Adolescent girls are at greater risk because even your body is not physically fit to impregnate the fetus, and is most occasions it becomes dangerous. Women of 40 or more years of age are at risk because your body has matured to and is now preparing to other hormonal changes such pregnancy are very dangerous both mother and the baby, and on many occasions the baby reaches born with different health problems. Most of the lives that manage to save are women who arrive in good time to even be at rest, and women who are late for reasons that were not treated on time or not attention that higher risk of dying them the baby or going to coma.
¿Por qué cree que las pacientes llegan en condiciones de embarazo adolescente? ¿Cree que es un factor la educación?
Educación en la escuela, educación en la casa, la falta de valores, principalmente porque si bien escuchan en el radio a cada ratito hay comerciales de eso, pero yo creo que no lo toman en cuenta. Hace falta poner más énfasis en las escuelas, que les digan importancia y lo riesgoso que es un embarazo en adolescentes. Corre peligro la vida de la mamá y corre peligro la vida del niño.
¿Cuál es principalmente la situación económica de estas mujeres?
Los pacientes que vienen a este hospital son de bajos recursos. Sí, y este hospital cuenta con el Seguro Popular, que es el que exenta el pago de las consultas. Este hospital es gratuito para esos pacientes.
Unfortunately, there are very serious parallel problems that are the main causes of these situations. And one of the main ones are the women's lack of education and also lack of economic values to protect and inform themselves. But also there are a lot of consequences of the maternal health problems, such as pressure and hormonal problems, gastritis, liquid retention, legs and back injuries, and vomit. But if the problem is more severe than that, it's more likely that the child or the mother is going to die because of the bleedings or infections.
The main problem is that the teenagers do not take this pregnancy seriously and they do not care. Well, eventually they care, but only at the end when their life is thrown to the trash. And usually they do not teach these lessons to their children, so this continues for generations and this needs to be solved.